Hi, everybody, and good evening. Thank you so much for joining us. Today, we are going through the 101s of egg freezing. So, I'm going to get my slide deck up here. Wonderful. Okay. So, what is egg freezing? Egg freezing, also known as oocyte cryopreservation, is a way to preserve your fertility by retrieving eggs from your ovaries, freezing them at very, very low temperatures, and storing them for future potential use. So, genetically speaking, as we know in our bodies, the potential reproductive potential of eggs age. Freezing eggs is like hitting the pause button on your eggs so that they stay the same age and behave the same age that they are today. Why do people choose to freeze their eggs? So, there are many reasons. One of the main reasons may be timings. One may not be sure about starting a family yet, or may not be ready to start a family yet, or they may have personal goals that are standing in the way of that, such as career, schooling, medical school, law school, business school, travel, or other priorities. There may be fertility related factors as well. So, somebody who is about to undergo a major surgery and can't get pregnant because of it for many years, but their egg reserve and egg quality may be different down the line. Or in cases of those facing gonadotoxic therapy, such as chemotherapy, radiation. That is how egg freezing came to be mainly, as we saw that it was safe and feasible in those cases, and now it has become more commercial, so to say. So, very important to know, of course, that the reason we do this and the reason this has become a thing is because fertility decline occurs, and this starts in the early mid 30s and more significantly declines in the late 30s. So within a 10-year span, there can be a huge difference in the reproductive potential of someone's eggs and whole reproductive system. And it really doesn't line up with our way of life here in the US and especially in New York City. So this is a overwhelming table to look at initially, but what this table is showing is the relationship between age groups, and egg reserve. So, egg reserve can be measured in two ways. One of them is by follicle count. So, if somebody does an ultrasound, if we take a look at the ovaries and see how many follicles we see, that is a example of measuring egg reserve. Follicles, and I'm going to use this term a lot, are little fluid-filled cysts inside the ovary that have an egg cell in them. Each follicle only has one egg cell in them. And the follicles that we see on ultrasound are not all your eggs. So if you ever get an ultrasound done and your doctor says, "Oh, I see 10 eggs," you might say, "Oh my God, that all I have is 10 eggs left." No, it does not mean that. It just means that this month your ovary decided to put these ones up to bat. So these are the ones that have a chance to grow big and then ovulate, but only one will. Sometimes two. That's why people have fraternal twins, but usually only one. When somebody has a high egg reserve, there's a lower number of eggs available to grow. For example, if were deciding to do egg freezing or IVF. If you have a high egg reserve, it means there's a higher number of eggs, again, on that stage, ready to grow. High egg reserve versus low egg reserve does not reflect your chances of natural conception per month, because that's more reflective of somebody's age and the egg quality. But it really only reflects how many eggs do we think we can get within one cycle. How are you going to respond to the stimulation meds when we try to grow them? So in this table here, we're looking at different age ranges and seeing that at age 20 to 24, for example, the average count we expect to see in a pinpoint of time is 20, which correlates with an AMH of 4.2. So AMH, also known as anti-Müllerian hormone, is a hormone that's secreted by those same follicles. So they are correlated. There are some rare cases where they don't correlate perfectly, but usually they are in relationship with each other. So you can see every 5 years or so, this AMH level drops by about 1 point. When somebody has very low egg reserve left, that AMH becomes undetectable. So if we're only seeing 1, 2 follicles per month, that means that the AMH is very, very, very low. And one of the important things to know about egg reserve and egg count is that egg reserve egg count does not go down perfectly linearly. It's not a perfectly straight line if we looked every single month, so to say. It's like a stock ticker. So it goes up, down, up, down, up, down, up, down. And eventually it will go down to zero, but it doesn't go down like a ski slope, so to say. Well, I guess the ones with bumps, you can compare it to that. Somebody with a low egg reserve at age 25, let's say their AMH is zero point 0.5 at age 25, has a higher chance of having a natural conception compared to somebody with an AMH of 3 at age 44. So it really has to do with the egg quality for natural conception. So why would someone's AMH be on the higher side but their AFC be lower? So there, like it is on the rarer side to have it not correlate perfectly. It may be that your particular follicles secrete a higher level of AMH, so it may not be reflective of the overall pool, but it may be a genetic factor that it appears that way. I'm not sure if that AMH was drawn at the exact same time as when the egg retrieval was done. Sometimes people have their workup and some months go by and then they end up doing it. So the AMH can change during that time period. So it is rare to see AMH 2.5 having that be associated with 10 follicles, but the breakdown from getting 10 to 8 retrieved is not unusual. But usually with AMH of 2.5, I'd expect to get somewhere closer to 15 or so. But again, that variation can happen. So just to discuss the egg freezing timeline, I just want to go through every day. So very important to know that egg freezing is not going to the coffee shop and getting a Frappuccino. It is more involved in that. It's more of a marathon. Well, if IVF is a marathon, the egg freezing is like a 5K, but it's still long and it's still involved. Short-lived, however, and it's all over within 2 weeks. When you get your period, that's cycle day 1. That's full flow of your period. We ideally want our patients to come in on cycle day 2 or 3 for something called baseline monitoring. During the egg freezing cycle, the patient will typically come in 6 or 7 times total. There are about 5 monitoring appointments in between. And once we monitor and we see that things have grown appropriately, we think we're going to get our highest yield of eggs, your doctor will tell you to use a trigger shot. So a trigger shot mimics the natural LH surge that happens that matures eggs. And the egg retrieval is 36 hours later. Why do we do all this monitoring? Well, we do the monitoring because we have to see how are you responding to medications? Do you need any medication dose adjustments? And of course, when are we going to time the final egg retrieval? Egg retrievals are done here in our operating room, adjacent to the embryology lab. We typically do them under IV sedation with propofol, which is the same medication that people get when they do colonoscopies or esophageal scopes, for example. It is a relaxing sleep and takes about 15 minutes. During that time, we aspirate all the follicles. So I think that's in the next scan. Should I take time off work for egg freezing? Depends what you do, but most people only have to take off the day of the actual procedure. Monitoring that you come in for is not every day, and we're open really early, like 6:45 a.m. And most people come in before work or during their lunch break. So this is what ovaries look like on ultrasound. This is an unstimulated ovary. This is an unstimulated ovary with a dominant follicle. These are stimulated ovaries. So this is an ovary with every single follicle at this big size. So when we do egg retrievals, we do it with with transvaginal needle aspiration. So a needle about the thickness of a safety pin goes in through the vagina right into the ovaries. And the vagina is right here, so it doesn't actually traverse that much ground. And it sucks out all the fluid. So there should be an egg floating in there. And we go through, we make sure all that fluid is removed. And the embryologist is constantly handed vials of fluid. And they check under the microscope right there with us. And they tell us how many eggs we're getting. At the end of the retrieval, they tell us a final number. And when you wake up, you'll get to know how many eggs were retrieved. However, it's only later in the day do you learn how many were mature, because they do have to sift and strip away the outside cells that are surrounding the eggs to be able to tell that. Then the mature ones are frozen later that day. We do keep our immature eggs in the lab to see if there's a chance they could reach that mature stage the next day, but there isn't as much evidence that those eggs are X amount of likelihood to reach live birth as the ones that are mature on the day of, but it's still a chance. So we still do look at them and freeze them. So a very important thing to know about the egg freezing and of course IVF process in general is that there is a lot of attrition. So keeping expectations reasonable is a very important part of this. Not every egg from the beginning of the stimulation process will necessarily grow. Only the ones that have good FSH receptors will respond to the meds we're giving. And much of this is out of our control. So all we can do is try to understand it and make it better if possible. On the day of trigger, how many of these do we retrieve? So if we stick a needle into the follicle, we expect to get an egg about 80% of the time. Of those, we expect the majority to be mature, about 70% or so, but that is much more variable person to person and cycle to cycle. Now, those are the ones that are frozen. So this is the cryopreservation process. So this is the hard red line here. Are you going to use those eggs? Perhaps not. But if you do, those eggs have to be thawed and they have to be fertilized using in vitro fertilization. And we have another question. Do we draw every follicle we can? Is it possible to remove every egg in the ovary, which would end future cycles? So we only draw the follicles that have fluid in them, and those are the only ones we can see. So all the other eggs are protected within the tissue of the ovaries, surrounded by lots of supportive cells. And since there's no fluid in them, we can't draw them. So it doesn't affect future fertility and future egg count. It only takes the eggs that would have otherwise already been lost because these eggs were selected to come up to the surface. Only one of them gets selected and grows big and the other ones die off. So when we do egg freezing or IVF, we take advantage of all those eggs and just try to buy more lottery tickets. It doesn't affect your microscopic eggs, so it doesn't affect your fertility later on. You can do egg freezing without hormones, but it would be very, very difficult. And it would mean only one egg at a time. Sometimes we can do egg freezing with very, very low amounts of hormones. Really should be tailored to what your egg reserve and your goals are. So next comes this big question of how many eggs should I aim to freeze? Studies show that at ages less than 35, 15 mature eggs frozen, assuming a 95% thaw survival rate, leads to about 83% chance at live birth of one child. For 20 eggs frozen, that's about 90% chance. For 30 eggs frozen, that's about 97% chance. But this varies highly by age, going up from age 35. So every increase in year after that, there are more eggs that need to be frozen to reach that same level of confidence. So if that level of assurance is at 80%, for ages over 42, 43, it's going to take an exorbitant amount of eggs to reach that 80% chance, which is why it becomes so difficult. But it is still a chance. So there's no age limit for egg freezing as long as there are eggs, but one just has to understand that there's a lower chance that it'll work. So can we get eggs? Yes. May they be mature? Most likely. Are they going to fertilize in the future? Probably, but is it going to make a viable embryo? That we don't know. And that's what becomes more uncertain with increasing reproductive age. And even if you freeze 100 eggs, it's not 100%. It becomes very close to that, but you never know what's going to happen in the future. What if the sperm you're using is bad? What if there's something else going on with the eggs and you didn't know at the time and you wish you had done another cycle? So all of these things have to be considered with egg freezing, that it's an increased chance in the future and not 100% insurance backup policy. There is no age limit for egg retrieval as long as we see eggs there. So if we see eggs there and if they're responding, then you can certainly still do it. And for my patients with older reproductive age, older than 44, I say, hey, can we get an egg? Yes, we probably can. Can we get eggs? Would they be mature? But are they going to result in an embryo in the future? That is much, much more uncertain. The egg quality, meaning like the chance that one meets with sperm and makes an embryo, declines so much within those ages. So at our clinic specifically, we have an age limit of the natural age of average age of menopause, which is between 51, 52. So some questions that we hear: are there any age limits to egg freezing? So I already just briefly talked about that. No, there are not, as long as you have eggs and are responding to medication, but you just have to understand the caveats, the process, and what the chances are. How long can eggs be stored? Eggs can be stored for as long as you should feasibly wish to use them within your reproductive life. If you decide to make embryos from your eggs, they can be used and transferred back into your uterus until the average age of menopause, which is between 51 and 52. If not used within your body, you may be able to use it within a gestational carrier, but typically until you're that age. You can also decide to donate your eggs. You can donate them to research, or you can donate them to a known person. This may require some legal contracts, signing away rights, but you can donate them. You cannot donate them anonymously, however. Frozen eggs can be used for any fertility treatment that involves in vitro fertilization. So not IUI, not natural conception, but with in vitro fertilization. Are there any risks or side effects? So I'm sure all of you have heard about side effects with IVF and egg freezing. So it's not really the injections that you do that make you have side effects, although of course a small injection might make you might feel a little bit of discomfort from that, or some itching irritation, but it's really the reaction of the ovaries to those injections. So as the ovaries respond to the hormone that stimulates them, they grow and estrogen levels increase. So it's a window to how you might feel when you're pregnant, but all of a sudden. So the ovaries grow, you might feel more bloating, cramping, because estrogen rises, you might have more fatigue, more rare things like mood changes, but that can happen too. All of this is self-limited. So after the cycle is over, you will not feel that anymore. The risks of the procedure. So the procedure is very easy and straightforward, quick. However, every surgical procedure has risks. Those include bleeding, infection, risk of damage to the ovaries and surrounding tissues. And this is very, very low with an egg retrieval. It's less than 1%. We give antibiotics to help decrease infection risk. We do everything under ultrasound guidance. However, these things are within that risk that is expected with a surgical procedure. So do we have any other questions? Are the side effects experienced a good prediction of what might feel when they're actually pregnant, but perhaps less intense? It may be, but with pregnancy, it happens slowly. Some do feel that the nausea comes on right away one day, but usually the feeling of like things stretching and being bloating, it happens more slowly, so it is less intense. But this is the thing to know with egg freezing or IVF, is that the catch of having a lot of eggs is you might feel more symptomatic. And the silver lining of not having a super high reserve is that you're more likely to feel pretty normal. So it's really, really different based on the person. Does storage time affect quality? Storage time does not affect quality as long as those eggs have been stored in proper conditions. So eggs are not in a freezer plugged into the wall. That's something very important to know. They are constantly in liquid nitrogen, which remains the same temperature it has to. And that liquid nitrogen has monitoring systems that look at the level of liquid nitrogen in the tank. And when the level gets to a certain point, there are alarms that say replace. And then every fertility center has like schedules for like how often to replace the liquid nitrogen. So even in the case of a natural disaster, we lose power, there's liquid nitrogen in there. Is it true that younger eggs are more likely to produce healthier babies? Younger eggs are more likely to produce chromosomally normal embryos, meaning not missing or an extra chromosome, something like Down syndrome. Sperm has to do with this too. So older sperm, and they've actually found a linear relationship, I think starting in 40s or at age 45 or so, that as sperm age increases, sperm doesn't really contribute to chromosomal abnormalities, like large chunks of DNA missing, but it does contribute to brand new single gene mutations that can then lead to some health issues, perhaps. Those are important things to consider too. Age by no means means you can't have kids or can't have healthy kids, but if you look at the large scale of data, they do see that healthier, meaning less likely to have like a brand new mutation or a large chromosomal defect, is associated with younger maternal paternal ages. But that doesn't mean like age 20 versus 30. This means like age 30 versus like 45. One egg retrieval cycle at Generation Next costs $5,000, and that's just the cost to our clinic. Then all the blood work, ultrasounds, the actual egg retrieval itself, and then all the processing and freezing of the eggs. Medications, which go through a separate pharmacy, cost $2,000 to $5,000, and it really is based on your body and how much medication we think you need. Anesthesia costs, if not covered by insurance, are about $600, and then storage costs are, I believe, $1,200 a year, but you can pay upfront for multiple years at a lower cost. And if you have any insurance coverage, it may cover like $1,000 of that. Sometimes some meds are covered, so it's important to check in on that. It depends what state you're in, depends what company you work for. If you work for a very big company, or if your spouse does for like something like Starbucks, Facebook, Google, they all have an insurance called Progeny that does cover egg freezing and like 3 cycles of it too. There are some other companies that have benefits through like Infertility or Carrot. So, and many of those only really have those benefits if they have like more than 80 employees. So you really have to check with your employer and your insurance company. If you find that your spouse has a different insurance plan, maybe switching over. And IVF, however, is starting to become covered by more and more insurance companies. I think New York may have a mandate for they have over 80 employees having some sort of coverage. However, different insurance plans may have different stipulations. So I would check in with your insurance company. I've always had regular periods and no known issues. Should I still consider egg freezing if I'm planning to have kids later? It depends how old you are. If you are 20 years old, I would say no. If you're 25 years old and you're considering it and you don't know when you're going to have kids, I would say any time between 25 and the early 30s, not sure when you're going to have kids, I would say come in for an evaluation with a fertility doctor. It will just go through what's normal, what to expect, more of an education visit, and we'll see how things look. And if we see any issues, then that's something that I might say you might want to consider revisiting in 2, 3 years, and at that point, take a look. If you are 32, 33 plus and still not sure, and don't have any plans in place for having kids, I would say in those cases, much more seriously consider it. If you have lower ovarian reserve, you haven't had kids yet, and you're not trying to conceive naturally right now, and you it's not financially burdensome, it's even more worth it to freeze eggs if it's low ovarian reserve. So I would say sometimes finances are the only thing that get in the way of whether someone's going to do something or not. So it's more worth it when reproductive plans are more unclear in the future, because whatever you do now is going to be easier and better quality wise than whatever happens in the future. But could you still conceive naturally in the future? Possibly, and we don't know that. There's a lot of unknown, but doing something like this protects more against the unknown. Well, thank you all so much for joining. This was a lovely conversation, and I hope to see some of you in the office one day. And I hope you have a great rest of your week and evening. Take care.